the American healthcare system. It's a labyrinth of paperwork, jargon, and baffling bills that often leave patients feeling like they're navigating a minefield. And the worst part? Even when you think you're covered, there's a good chance your insurance company might just say, nope. Take the case of Shelby Kingy. Shelby was battling ALS, a truly devastating disease. She needed a specific medication, one that could potentially prolong her life. Her doctors agreed, prescribing her the drug. But her insurance company, Blue Cross Blue Shield of Texas, repeatedly denied coverage. They claimed it was experimental. This is the dark side of American healthcare claim denials. Insurers use them to limit costs, often leaving patients scrambling for options. These denials come in many forms. There's prior authorization, where your insurer needs to pre-approve treatments before you can get them. Then there are outright claim denials, where they simply refuse to pay for services you've already received. And let's not forget about denials for experimental treatments, even when those treatments are a patient's last hope. The impact of these denials can be devastating. Patients are left with mountains of medical debt. They're forced to delay or forgo necessary treatments. And in some cases, these denials can have fatal consequences. Shelby Kingy's story is a tragic reminder of the human cost of these bureaucratic decisions. You might think there would be clear data on how often these denials happen. You'd be wrong. The Affordable Care Act aimed to bring more transparency to the system, but it's still incredibly difficult to get a clear picture of just how many claims are denied and why. Insurers do report some data, but it's often incomplete and difficult to compare. It's like trying to assemble a puzzle where half the pieces are missing, and the ones you do have are written in a language you don't understand. But we do know that millions of Americans struggle to pay medical bills each year. The Kaiser Family Foundation found that a staggering 73 million people faced this challenge in 2023 alone. This lack of transparency is a major problem. It allows insurance companies to operate in the shadows, making decisions that impact people's lives with little accountability. It's time to shine a light on these practices and demand better data and greater transparency in the healthcare system. Now, you might be thinking, surely there's a way to make these decisions more objective. Well, some insurance companies have turned to artificial intelligence, using algorithms to process claims. But instead of solving the problem, this has just created a whole new set of issues. Lawsuits have been filed against major insurers like Humana and Cigna over their use of AI in claim processing. Experts estimate that these algorithms could be wrong 25 to 30% of the time. That's right, 1 in 4 decisions made by a computer could be inaccurate, potentially denying patients the care they desperately need. The use of AI in healthcare raises serious ethical questions. Can an algorithm truly understand the nuances of a patient's medical history and make life-altering decisions? And who is ultimately responsible when these algorithms get it wrong? It's clear that we need greater oversight and regulation before we entrust our health to lines of code. Let's face it, the American healthcare system is an outlier. We spend more per capita on healthcare than any other developed nation, a whopping $3,432 per person. Yet, we have the lowest life expectancy among comparable countries. It's estimated that we waste at least $220 billion annually on unnecessary administrative costs and inefficient care. Meanwhile, countries with universal healthcare systems like Canada, the UK, and France manage to provide quality care to their citizens at a fraction of the cost. They achieve better health outcomes with longer life expectancies and lower infant mortality rates. So, what are they doing differently? Well, for starters, they prioritize the health and well-being of their citizens over the profits of insurance companies. The evidence is clear. The American healthcare system is in desperate need of reform. We need to address the root causes of high costs, improve access to care, and ensure that everyone has the opportunity to live a long and healthy life. It's time to stop accepting a system that prioritizes profits over people and start demanding better for ourselves and future generations.